So I want to talk about your book, but first, let's start with breaking news. We're hearing that the Centers for Disease Control is going to be issuing this afternoon a new set of guidelines, actually calling on people who have been vaccinated against the coronavirus to resume mask wearing in some circumstances. Can I get your reaction to that? I know that you and I have spent a lot of time through the pandemic talking about previous guidance and what was maybe good and not so good about it, and you have a lot of thoughts on that. But what do you think about this latest news about updated guidance?
Well, I think it's unfortunate that we are where we are, but we have to acknowledge that the situation has changed from even a month ago. I mean, COVID-19, the number of new daily infections is 5 times where they were a month ago. We have the Delta variant, which a person infected with the Delta variant gets 1,000 times the viral load than with the previous variants. So the situation has changed. And we also know that the honor code that the CDC was relying on earlier did not work, as many of us predicted that it wouldn't. And so there has been a growing chorus of public health officials calling on the CDC, calling on the Biden administration to change their guidance and to try to rein in this latest surge. And so I was one of those people. I have been one of those people. And so I think that their guidance certainly is very important. It will be disappointing for people to hear. And I want people to know that the guidance is coming out not because the vaccines aren't working, but rather the actions of the unvaccinated are setting all of us back. The unvaccinated, the infections among the unvaccinated are spilling over into the vaccinated. And this is the reason why masks are coming back. And I think at this point, the CDC and the Biden administration need to go a lot further than mask mandates. They really need to get behind vaccine requirements and proof of vaccination.
Well, and I want to talk about requirements, but let's just talk about the science that we know and how our understanding has changed, or perhaps the Delta variant has changed what we know. I know back in May, you and I talked a lot about how it seemed as though the vaccines were quite effective in terms of not only preventing serious disease, but also preventing spread of the virus. But it looks like now with the Delta variant, it turns out people actually can have a much larger viral load. Can you talk a little bit about how you see the science on this is sort of changing, or our understanding unfolding, and then sort of dictating what the new guidance should be on mask wearing?
Yeah, it's a great question. And I think a lot of people are going to be looking at the CDC's guidance today and wondering, well, is it flip flopping? Well, it's not flip flopping if the science has changed. As in, constant reevaluation is the bedrock of public health policy. You wouldn't expect for the policy to be static if the science is changing. What we know is that the vaccines that we have are very protective still against severe disease, severe enough to cause hospitalization or death, such that more than 99% of people who are dying from COVID in this country are unvaccinated. So you're essentially protected from dying from coronavirus if you get vaccinated. That's huge. And that's the reason why we have these vaccines. That said, we don't know the degree to which the vaccines that we have protect you from contracting COVID-19 or giving it to others. Again, you're unlikely to get severely ill yourself. But I think many of us are wondering if we live at home with unvaccinated children. I have a 1 year old and an almost 4 year old. I think a lot of parents are in this position where the parents are vaccinated, but our young kids are not. Or what if we live at home with someone who is immunocompromised? Even if I don't get very sick, I don't want to be bringing back the virus to our loved ones. And so I hope that that is what the CDC will be acknowledging today, too, that we just don't know with the Delta variant, because of this higher viral load, what is the likelihood that we could be carriers for coronavirus and transmit it to others around us? And that's why, in the absence of that information, using an abundance of caution, specifically urging mask wearing in indoor crowded spaces, is a good idea.
What details are you specifically looking for from the CDC this afternoon? Do you think that this guidance should be geographic? Should it be related to the transmission of the virus in certain communities? Should it be nationwide? What kinds of details would you like to see?
What I would love to see is for there to be a blanket indoor mask guidance that's given with some exceptions, two specific exceptions. One is to say that if the community has reached a high level of vaccination, and I think that would also help to motivate different parts of the country to achieve that rate, then indoor mask mandates can be dropped. The second, and I actually think it's even more important, is to say when there is proof of vaccination, then indoor mask requirements don't need to be in place. As in, we still believe that vaccinated people if they are around others who are also fully vaccinated, their chance of being a carrier for coronavirus and then transmitting it to someone else is pretty low. And then the other vaccinated person, their chance of actually acquiring coronavirus is very low. And so vaccinated around unvaccinated would be not safe, but vaccinated around vaccinated would also be safe. And so I think that kind of guidance, that very specific one detail, would be really critical for the CDC to give. That also helps to pave the way for institutions like workplaces that are coming back for in person, or schools and campuses that would encourage vaccine mandates in those situations, but then also allow for an environment that's not only safe, but also comfortable. As in, now these individuals, if you're surrounded by also vaccinated people, you do not need to be wearing a mask or practicing distancing.